This is my journey with the creatinine fighters and their fight against a high creatinine level. Good morning.
Good morning.
What's your name?
Celia Fernandez.
Since how long you're a CKD patient?
1 year.
Like what was the actual problem that it started with?
Well, I just went for a blood test.
Okay.
I had no symptoms. Okay. And on my blood report, the creatinine was high.
What was it?
I think it was around about 5 plus.
For stone. I was operated. So after that, nothing happened to me. Then I got swelling
Swelling in the ankle.
ankles. Then I went to check up. Then they said my creatinine was high,
How much was it?
8.
It is from birth had a defect in the kidney. One kidney was like not growing small, and the other was normal. But the brain was giving us signals that not working and all that. So high BP, then both went off. Yeah.
So both went off. So
At
you
the age of
transplanted-
21. Yeah.
You transplanted one.
Yeah, it transplanted one. Yeah. My mother gave me. I was okay. And in COVID time, then that infection, COVID infection, that triggered it, and again that also.
I am Sushmita Sudesh Tilve from first year BMS, and in this video I am going to explain what is creatinine. Creatinine is a waste product generated from muscle activity and the breakdown of the muscle tissue. Now let us understand how the creatinine is synthesized. Creatinine is synthesized primarily in the liver by methylation of glycosamine by H-adenosine methionine. It is then transported in the blood to the other organs, muscles and brain, where it is phosphorylated to phosphocreatine, that is a high energy compound. Creatinine conversion to phosphocreatine is catalyzed by creatinine kinase enzyme. Creatinine is synthesized in the liver, kidneys, and pancreas from the amino acid glycine, arginine, and methionine. Now let us understand where this creatinine is stored. The creatinine is stored in the skeletal muscle as phosphocreatinine. This slide will show you the creatinine metabolism. Now, let us understand what leads to increase in the creatinine levels in the body. First, kidney-related causes. Chronic kidney diseases, also known as CKD. Second, kidney infections. That is, inflammation and damage to the kidney tissues, impairing the ability to filter waste. Thirdly, urinary tract obstructions. Conditions like kidney stones or an enlarged prostate can block the flow of urine. Glomerulus nephritis, that is, inflammation of the kidneys filtering unit glomeruli. Polycystic kidney disease, in which there is cyst formation in the kidneys, impairing their function. Now let us understand other contributing factors for the increase of the creatinine levels. Firstly, dehydration. Dehydration is insufficient fluid intake, which can concentrate urine and reduce kidney blood flow. Secondly, high protein diet. Excessive protein intake can temporarily strain the kidney as they process the breakdown product, including the creatinine. Medicines like NSAIDs, some antibiotics, and some chemotherapy agents can also impair the kidney functions. Normal lifestyle diseases such as diabetes and hypertension can also lead to the damage of the blood vessels in the kidneys, reducing the filtration capacities. Muscle disorders, intense physical activities, pregnancy, and heart diseases like atherosclerosis or congestive heart failure can also lead to increase of the creatinine levels in the body. Now let us understand the normal creatinine levels. The normal creatinine levels in men and women are different. In men, the creatinine levels in blood is 0.7 to 1.3 milligram, and in women it is 0.6 to 1.1 milligram. Urine of 24-hour sample, for man it is 14 to 16 milligram per kg per day, and for women it is level to 20 milligram per kg per day. The diagnostic test for creatinine level is blood test and urine test. Now, let us understand the symptoms of increased creatinine level. Fatigue and weakness. Impaired kidney function can lead to buildup of waste products in the body, causing fatigue and overall weakness. Swelling, particularly in the lower extremities such as legs and ankles, on face and can occur due to inability of the kidney to regulate the fluid balance. There is changes in urination. There are muscle cramps, shortness of breath, nausea, mental confusion, low appetite, lack of sleep, seizures, and hypertension. Now, Ayurvedic approach to manage creatinine levels in the body. Firstly, dietary adjustment. Cut back on proteins, as too much of protein from red meat can boost urea and strain the kidneys. Choose plant-based proteins like lentils in small amounts. Secondly, cut down on salt. High salt intake can raise blood pressure and harm the kidneys. Use rock salt. Keep meals light and fresh. Warm homemade dishes from fresh ingredients work best. Example, khichdi. Drink smart. Get enough water but don't go overboard, especially if you have swelling. Instead of water, you can just go for coriander, fennel, and cumin, Ayurvedic kidney teas. Lifestyle changes. Do yoga daily. Gentle poses that promote detoxification and increase the circulation to the kidney include Pavan Muktasan, that is wind relieving stand, Setu Bandhasan, that is bridge pose, and Bhujangasan, that is the cobra pose. Secondly, pranayama and meditation. Stress is a major factor in chronic kidney disease, and breathing techniques like Anulom, Vilom, and Brahmari can lower it down. Dinacharya. Get enough sleep, eat meals at regular intervals, and wake up early. Do not take painkiller tablets. Herbal areas to manage creatinine levels. Firstly, Punarnava. Punarnava is commonly utilized for its diuretic properties, which aid in the removal of surplus water from the body. It alleviates swelling, that is edema, and improves kidney efficiency by decreasing retention. Secondly, Gokshura. It lowers creatinine level by increasing urine output. Shirisha purifies the blood and enhances filtering by the kidneys. Varuna improves kidney filtering efficiency. The bark of Varuna is used to make herbal teas and decoction. Chandan improves urine flow and alleviates burning sensation. Management of the creatinine levels in chronic kidney diseases. Firstly, let us understand how to manage the blood pressure. The blood pressure of the chronic kidney disease patient should be less than 130 by 80 mmHg. Second, dietary management. Low protein diet, low sodium diet, potassium and phosphorus management. Third, addressing metabolic acidosis. Maintaining a proper acid-base balance is important. Thirdly, lifestyle modification. Regular exercise, quit smoking, weight management, avoid nephrotoxins such as NSAIDs and some antibiotics, and management of diabetes. Now, let us understand the herbal preparation to reduce creatinine level which was recommended by me to the patient. The requirement to create this herbal medication includes pipal leaves, neem leaves, guduchi root powder, and water. The procedure to make the medication has been described or prescribed on the slide. Now the question arises, why only these three herbs and why not the others? First, let us understand why only neem leaves. The neem leaves have antioxidant properties, anti-inflammatory effect and renal protection. By reducing oxidative stress and inflammation, neem can help protect the kidneys from the damage caused by various factors such as infections and toxins. Secondly, why people leave them? Diuretic effect and anti-inflammatory. Third, why only guduchi root powder? It acts as an immunity booster and helps to detoxify the kidneys, reduces inflammation and supports kidney impairment. And it also helps in the kidney repair. The following slide also shows the report of the decreased creatinine levels with the herbal allies which I had recommended to the patient. Thank you.
म्हजें नांव सुदेश टिळे. हांव लास्ट 6 वर्सां जालीं CKD आनी 4 म्हयने जाले आतां हांवें आयुर्वेदीक मेडिसीन चालू केल्लें आसा जे पिपळ आनी पिपाची पानां आनी कडुलिंबाची आनी सकाळीं आनी सांजचें 2 वेळा घेता. देखून खुबशे डिफरन्स जाल्ले आसा. अशें म्हणजे म्हाजें हेमोग्लोबीन मेंटेन जाल्लें आसा अबावट 10. क्रिएटीन जें 10च्या वयर आसता तें आतां 7चेर पावल्लें आसा. BP सदांच फ्लक्च्युएशन आसता तोय नॉर्मल जाल्लो आसा. BP मेंटेन जाता आनी जे बारीक बारीक त्रास जिवाचे ते खूब कमी जाल्ले आसा. आनी हे जे वखद आसा ते हांव आतां कंटिन्युअसली चालू दवरतलो.